it was sad that it was like raining a lot, but I had no idea what was going on. And then I got a text from Peggy later that day, who lives in Nevada. She was like, oh, okay.
I think it would be really easy to ignore the population that CHC serves. Many other practices and people in general do. Let's be honest, this is not a population that produces a lot of income or interest for other providers or people in general. We should feel energized when we think about what we're doing for this underserved population. The variety of programs that CHC is involved with and the progress that is being made should be recharging to all of us. How many other healthcare programs can say that they are as focused on providing quality care to this population of patients across the country through the implementation of the innovative programs that CHC offers? I'm just going to go out on a limb here and guess 0? This should recharge us all, and I applaud CHC for what we are involved in. I am proud to say that I work here. Working in the triage department feels like being among the front line of a large team. We take the calls, decide which direction to route the patients. Some are quickly triaged to the emergency department via 911. However, in many other cases, we prioritize situations knowing that we have an assortment of medical, behavioral health, OB providers that we can reach out to for assistance if needed. The staff nurses provide clarity on some complex patients who they are very more familiar with than we are, and sometimes they even take over the calls. All positions work together as a team, providing critical information and support to each other. CHC as a company encourages and models this. I'm just going to close by quoting the Army Nurse Corps motto, which I feel reflects our company as well. Selfless service to our nation, embracing the past, engaging the present, and envisioning the future.
Why did I choose nursing? For that very reason, to have these individuals care about someone, a complete stranger, and provide outstanding care and go above and beyond is something truly inspiring, and that's what it truly inspired me to become a nurse, to give back what they have given to my family. Nursing really chose me. It wasn't something that I necessarily chose. It's something that I knew that I wanted to give back. I wanted to give that sense of caring back to these individuals, and everyone comes from a story, and I think sometimes we forget how everyone has a story in life, and it's all about understanding that story and placing yourself in that person's shoes and providing that same level of care that we know that we all deserve. So why did I choose primary care? It's the first line of care. And that's something that I want to be a part of, to educate the patients and to really give back to an underserved community, stemming from an underserved community. So I know where the disparities are, and the sense of education and the sense of, providing and making sure that these individuals know that they're cared about, whether outside of work, inside of work, just knowing that they have a place in someone's heart. The skills we utilize every day for our patients are our eyes that look beyond appearance, our hearts that feel beyond ourselves, and a mind that thinks beyond the norm. It's not easy to put yourself in your patient's shoes and understand the level of care that they deserve. But us nurses, we do it proudly, and we do it effortlessly with the help of others, which we also have to give recognition to the MAs, the PSAs, the technical support, the providers who are always willing to answer questions that we have. So we couldn't do it without them as well. It's definitely speaks to my heart every time that I have my mother turn to me and say that she's proud that her son has become a nurse. And that's everything that I stand for and I live for on a day-to-day basis, because truly there's nothing more rewarding than being a nurse and giving selfless care to these individuals that deserve it.
So this morning, I woke up at 5 a.m. My alarm comes in the form of one screaming baby that awakens the other one, and a chorus of demon angels lets me know that I need to rescue them from the quietness of the morning. I left my house 3 times this morning. I literally had to go back twice because I had forgotten some things, including that today was the nursing dinner and I had to get a change of clothes. Refocus your purpose to understand that we are more than vaccines and telephone encounters. We really have autonomy here, and we have the autonomy to work at the top of our license and show our worth, because we are not here to check boxes. Certainly, I acknowledge the value of all other nurses, but when it comes to primary care, we are it. We are the defenders, I feel like it, defenders and protectors of health. First in line, as Luis said. My job is to keep you out of the hospital. My job is to make sure that you have resources available to attain optimal health. So when you step into my exam room, I'm gonna ask you hard questions, and I'm gonna gather as much information as I can so that I can begin to put pieces together. And then I'm gonna connect with my team, and I'm gonna create a plan of action so that we can bring that patient back and discuss what the team has suggested, and in collaboration with the patient, ensure that the plan is attainable and we can work together to meet our goal. I'm not asking you to dig deep. I'm asking you to become aware. Everything we need, we already have. See yourself as the transformation nurse. The nurse that understands the power she has is the nurse that can yield that power effectively and co-create change in the life of the patient. I am literally a link away. Thank you.